So, tell me a little bit about what you do. You seem like you have an amazing career as a doctor.
Well, I've spent most of my career looking to find ways to solve problems in medicine to make a very early diagnosis in the hopes of preventing disease rather than waiting for it to develop. And then you spend a lot of money and people get sick and die. Because, most of what we deal with is preventable. And unfortunately or fortunately, it's mostly due to lifestyle, you know? So I've spent many years developing laboratory tests, technology, digital microscopes, various things just to really help people get a better handle on what their health status is at an early stage.
Very good. And as everybody in the world knows, right now we're going through the coronavirus pandemic. What can you tell us about that, and how could people prevent it?
So it's a very interesting virus. It looks like with the better testing, the death rate is actually relatively low compared to, for instance, the flu. It's a virus that likes to bind to a receptor in your body. It's like a Velcro pad. You stick to it and it hangs on, and it turns out that receptor is called the ACE2 receptor. And for people that have blood pressure problems, it's one of the targets for blood pressure medicine. So it's really fascinating because the most dense layer of those receptors is on the lining of your arteries.
Oh, wow.
And that's why you're seeing young people have blood clots and heart attacks and strokes, because it damages the endothelium, the lining of the arteries. And because of that, you can see disease manifestations in any organ. But what's interesting to us is that most of the patients we've tested that are positive have not been aware that they even had an illness. They had no symptoms, or if they did, they didn't notice them. We've had a few people that had disturbances of their taste or smell, or maybe one day of aches and pains, something like that. And maybe a low-grade fever. But it makes sense that the people that are most susceptible to it are overweight or diabetic or have cardiac disease. The reason is because those illnesses damage the layer of the arteries, the lining of the arteries, the endothelium, make it more susceptible to damage, so that the virus would be more prolific there, more able to injure them. And it's interesting, there are a number of compounds that aren't available in this country. Like one of them is called Camostat mesylate. It's available in Japan, and it's very cheap, and it blocks the virus from getting into your body, but it's not available here. But other countries have been fairly creative at doing those things. And, I think we're going to get through this. I think I'll give you one other tidbit. It may be too technical. You can shut me up. But the Singapore people have done the best at tracking people with illnesses. And what they've shown is that a couple of things. One, they did a study to see what people in the community had what's called cell-based immunity. It's not an antibody, but it's where a cell will actually attack a virus. And they found out about half the population that they tested had T cells, they're called helper T cells, that were able to clear the virus without the need to mount an antibody response.
Oh, wow.
Okay. So, well, and there's a punchline to this story, and that is that people who have actually had the infection and documented antibodies, 100% of them have these T cells. But here's an example of why it's important, because I had a husband and wife. The wife had the infection in November. She had antibodies. The husband took care of her the whole time, never got sick, has no antibodies to it because he's got those T cells. And we see that in a number of places. So I'm actually more optimistic about what we call herd immunity, because I think there are people out there. And by the way, those T cells are educated by the common cold. There's 4 varieties of common cold that are coronavirus that make those T cells attack the new COVID-19. So I think it's really cool. And it means that I think we're going to get to herd immunity faster than people are predicting.
Knock wood. And now I've heard of two different kinds of testing. I heard for testing for the actual COVID-19 and testing for antibodies. What's the difference between that?
Yeah, so if you have symptoms, you're more than likely shedding virus. And in that case, the molecular test detects RNA from the virus. That's their nucleic acid. That's the genetic information they have. And it has a few problems. Number one, it can detect both dead virus and living virus. So you can still detect virus from people, maybe a month or so later. The key there is, though, that virus is dead, but it's extremely useful for diagnosing somebody with symptoms. Okay, the antibody test detects whether you've had an infection in the past, and you've mounted an immune reaction to it. And the CDC has put out a memo that basically indicates, and the data supports it, that if you have either IgM, IgA, or IgG antibodies, they're all different types of antibodies, that your likelihood of infecting somebody is extremely low, and that you more than likely have immunity based on our experience with other viruses. So it's a good thing. The other thing that the antibody allows us to do is detect the real level of prevalence of the disease in a population, because most of those people have not had symptoms. Okay, so the difference is, one is a nucleic acid test and the other is an antibody test. It's a serum-based test. Okay, I don't know if that makes sense.
No, it completely makes sense. And what else can you tell us about how to deal with this new, I don't know, I don't really want to call it the new normal, but the new way of living, I suppose, for the time being? How can we remain healthy?
Yeah, so obviously you're aware it's very controversial. There's all kinds of, mystery, I call it mystery medicine out there. One thing I can tell you is all the models have been wrong. Their predictions have been wrong. And I think it's better if we just rely on past experience with viruses that have infected populations like flu. So what that means is taking adequate precautions, wearing a mask when you're in public, washing your hands a lot. Hand washing is extremely important. And what's interesting is the mask, the mask actually does two things. The average human touches their face about 2,000 times a day, like you're touching your hair right now. And I like
nervous
to go
habit.
like
I don't even realize I'm doing it half the
I
time.
know, and
so
you don't.
Guilty.
But the mask keeps you from transmitting. When you're out in public and you touch the shopping cart, it keeps you from putting your hand up here and doing what I'm doing right now, which is,
you're right.
This. And so it's really important from that perspective too, because the actual virus is quite small and it gets around the outside of the mask. But if you sneeze, it'll stop some of it. And so I think that's important. And the other thing is hand sanitizer. I just use, this is isopropyl alcohol. I just get it at the store, and that's the boss next to me there. It's 80% or 70% isopropyl alcohol. You can use it on the steering wheel inside the car. It won't damage anything, and it kills the virus. And it's cheap. It's very cheap, And then I would be remiss if I didn't comment on the controversy surrounding hydroxychloroquine. Okay. So I think most people have heard, that the president of the United States came out and said that hydroxychloroquine was effective. And I lectured 800 doctors in Asia a month ago, and the most common question I got from them was, why were we down on hydroxychloroquine? Because they've used it for 70 years and they found it to be very effective. And then there were two papers that came out, one in Lancet and one in the New England Journal of Medicine, that said it didn't work. And then subsequently, those papers had to be retracted. The people that wrote them, who were full professors, were fired because the data was false. And in Detroit, Michigan, at Henry Ford Hospital, they did a very, very, very well done study that showed that hydroxychloroquine with zinc, which prevents the virus from getting in, along with azithromycin, which is commonly known as a Z-Pak, is very effective, but only if it's given early. So by the time you're in the hospital on a respirator, you need to try something else like remdesivir or something like that. So there is hope on that side. Okay. So I wouldn't discount it. And it is the first line for most of the hospitals I've been talking to. They do at least a 5-day course of it if you come in with symptoms to keep you out of the hospital. So I think the other thing is there are some other older drugs like dexamethasone, which is an old steroid that's used to decrease inflammation. And they did a beautiful study in the United Kingdom that showed that it prevented people from going on respirators, and that it actually, there's this, one of the things that damages people when they have this virus, it's called a cytokine storm. And the way to think about that is your immune system is meant to protect you, but if the body hasn't figured out how to shut it off, it can start damaging you, you know? So you have people with rheumatoid arthritis or lupus, their immune systems aren't doing the right thing. They're damaging their bodies. Well, this virus can induce a cytokine storm, and dexamethasone appears to stop that. So it's very important. It's very cheap and very effective. So there's a lot of hope out there. And the most important thing is for you to get a lot of sleep, stay healthy. And I'm going to talk about one other area that people forget about.
Okay.
That's the bathroom. The bathroom. The toilet can launch droplets up to 20 feet away. And so if you use public restrooms, you have to be really careful at this time. And in families like where we have somebody that got the illness, what we do is we tell them to please use a different bathroom, and that's their bathroom, and don't let anybody else use it. Okay? But hand washing.
Fair.
Yeah. So those are kind of the top level things. Anything else you'd like to know?
Tell me one more. You said you were doing a blood drive. Tell me a little bit about that before I let you go.
Sure. So I'm a volunteer doctor and chairman of the Garda Heart Foundation, and their whole goal is to prevent disease and to do community service. And they've partnered up with a number of companies and churches, like Coast Hill in Orange County here. And what they do is you'll find that a lot of doctors will not accept COVID patients if they have symptoms or anything, if they've been exposed. They just won't take them in their office. And also people are afraid to go to urgent care or hospitals because they're more likely to get exposed to somebody who's sick. So what we've done is we've set up remote blood draws, the Garda Heart Foundation. It's 100% volunteer except for the phlebotomists. And they'll go in and they'll set up tents so that you can maintain social distancing. Everybody wears tents. They have temperature checks on everybody. There's a questionnaire on symptoms, and they schedule them. It's by appointment only, and you know they can do 200 or 300 people in a day, and it's really expedited testing here. And so, Garda Heart is not just in California, but they did an event in Michigan and some other places, and it's mainly where it's needed. And under the CARES Act. Anybody that's getting the blood work done should not have to pay for it. It's covered. Even if you don't have insurance, there's a program through Optum. And the test that they're doing is the antibody test. So it's not for people with symptoms. It's not for diagnosis. It's for people who are exposed, have a family member, or who may have been sick in the past, okay? Or who want to know. And it's also mandated in California. Everybody is supposed to get tested, so that they can effectively determine the prevalence of the disease here, the real prevalence, okay? So.
Gotcha. Well, thank you for all that incredible information. Hopefully people will take it to good use, and thank you for all you do. You're amazing.
Well, thank you for having us on, and stay safe, okay?
You too. Thank you. Be safe. Bye-bye.
Okay, bye-bye.